All right. And so I will just remind those who maybe didn't join us in the beginning. I am Niesha Foster, Vice President of Global Health and Social Impact at Pfizer, and I co-lead the Multicultural Health Equity Collective with Melissa. What all those words mean is that I have the privilege of working with partners internally and externally to make sure that we're using our people, our finances, and our product to close health equity gaps globally, and also work with community-based organizations here in the US on programs that they're implementing to reduce health equity, health disparities, and improve health equity across all underserved and underrepresented groups. When we envisioned this panel and this summit, we wanted to make sure that we centered community-based organizations. At Pfizer, we say that people are the expert of their diseases because they are treating themselves and trying to manage their symptoms, long before they're physically and formally diagnosed. And so we believe the same thing about communities. They know what they go through every day. They know what their needs are. And it's up to all of us to listen to them to make sure that we are enabling their success to achieve their best health outcomes. And so I'm so honored to have so many people on this panel with me who are really doing that work in local communities to understand what the challenges are, the gaps are, and help identify those solutions that are going to improve lives every day. So I have each panelist introduce themselves and tell us about the why, the work that they're doing, and how they came to that work. I'll start with Bethsy.
Thank you, Niesha. Hi, everyone. Bethsy Morales-Reid. I'm the Vice President for Program Strategy and Impact at Hispanic Federation. I've been there for over 10 years, but while I'm kind of like overseeing programs of different topics, my background is public health, and I've been doing that for over 20 years. I know I don't look a day over 20. Thank you very much. I wish. But it is, so I've seen firsthand a lot of the public health issues in our communities and how our communities are dealing with it. So I think, we heard today a lot about data and the importance of data, and we should be looking at that, right? Latinos have, I'm speaking from based on the work that I've been doing, dealing with Hispanic Latino communities. There's a lot of issues in terms of like medical debt and not going to the doctor because of maybe not having a primary care doctor or because of the lack of a culturally competent provider, right? So all these things, but I will give you two human stories, yes. Right? On like what motivates me, yes. Right? Like why I'm doing this. Mm-hmm. So we, Hispanic Federation, we provide events where we bring health screenings to disadvantaged communities that may not have access to doctors or health insurance. And one time we were providing dental visits to folks, and they were there getting dental screenings, but then we were also providing like vouchers for them to actually go see a dentist for work that needed to get done. And this woman gets a voucher, and then she's like, is it okay if I transfer this to my sister? Because my sister has been dealing with a toothache for a month, for over 30 days. And she hasn't been able to go to a dentist because they didn't have insurance. They could not afford going to the dentist. So it's like just simple things like that, like not being able to, like dealing with that pain for days, over a month, because they didn't have access, right? So that's why it's important that we do the work that we do so that we can bring access. And then the other quick story is this one, in thinking about having culturally competent providers and how we talk about workforce pathways and why that's important. There was this woman that we were working with. This woman was going to the doctor, tells the doctor, hey, I can't sleep. And the doctor's like, what's wrong? Why can't sleep? Well, it's the tigres outside. They're making all this noise. They're not letting me. So tigres translates into tigers, but we call tigres the guys in the street. So she's saying the tigres outside, and the doctor, she ended up in a mental health institution for over 30 months because the doctor thought she was hallucinating, she was hearing things. So again, it's not just the language, but also the being culturally competent, the cultural competence that comes along with that. So that's why I'm in what I do, in the field of the work that I do.
So powerful. Dr. Glenn?
Good afternoon. I'm Howard Glenn. I'm the fifth child of the late William and Essie B. Glenn, and we started the William and Essie B. Glenn Family Foundation for Better Living. We did that in 2014, and we did it to honor the legacy of our parent who had the idea of service to the community was the best thing that you can do. And to do that, well, I think my brother Clyde shared with you this morning, we had a truck patch or a big garden that was behind our house, and all of us had to tend to that garden, but all of the neighbors got the benefits. And that wasn't the most exciting thing, but we struggled through it, and as a result of that, we began to develop a theory and a concept for why they were doing that. It is very important to serve your fellow man. And in honor of them, that's the thing that we did when we established the William and Essie B. Glenn Family Foundation for Better Living. And in doing from there, we moved on to try and get some idea of exactly who we are and what we were going to do. Well, my mom was a cook, and she worked in the local schools and in Head Start for 30 years. My dad was a carpenter. He served the community as a carpenter. So service is kind of ingrained in what we do. And as a result of that, we all grew up and left our native community of Cleveland, Mississippi, which is down in the Mississippi Delta in Bolivar County, and went out to our respective places. And we had several siblings. You heard from Clyde Glenn this morning. He's the president and chairman of our foundation. We have our CEO and executive secretary, and my sister Helen out there. And we have my sibling who followed me in dentistry, Verna Lucas. And so we are part of the organization that moves forward to kind of get things going. And when we heard that this equity conference was going to be, we said, Pfizer did it 2 years ago, we're going back. and we're glad that we did. We're glad that we did, because this has been different. And not only has it been different, but it has definitely offered opportunity to give us tools to take back and be more effective in what we do. Even to the last caution that we had with AI, Matt, it was really interesting. And I think the most important thing that we have at this time is that at the mission that we put forward. And we are trying to create thriving communities. And we're trying to do that by eliminating the obstacles that impede life outcomes and allow people to choose and make good choices about their health care and the role that their health plays in their total life spectrum. Now, when we look at what we've done here in the Cleveland community, oddly enough, I did share with you that oddly enough, we only have one sister there in our family. There were 8 boys and 3 girls. My mother had all 7 boys before she had any girls. Wow. And so, but at any rate, we love our sisters. We forgive them for not doing any of the work that we had to do, but it's okay. But anyways, it turns out what we end up having to really focus on as siblings is that we went to different places. I live and practice in Memphis, Tennessee. My sisters Helen and Clyde live down in Madison. And we only have one sister that actually lives in our Cleveland community. But we feel so passionate about what we can do to help to improve the life outcomes of individuals in that community that we come back every year, and that's where we put out the focus of our work. Our work started with a school lunch program because, hey, following mom, she cooked for the kids. So we discovered and determined that during the summer months, kids don't really have nutritious foods because they just don't get it. So as a result of that, we started a partnership with the Mississippi Food Network and served school lunches. That went on for about 4 or 5 years. And then we said we need to do better and do more because this is just not enough for what we are about as the Glenn Family Foundation. So we then started a health and wellness and safety tailgate. And the reason we called it that because it was going on during homecoming. So everybody could identify with the tailgate, and the health and wellness part of it was what we carried forward. But that happened for a couple of years, and again, we thought the importance of reinventing ourselves, and so our illustrious CEO put an attachment to it. She said we are going to be HEiA, health, wellness, and safety, and that is essentially what we are now, but we're still doing the same thing. We are providing healthcare opportunities for individuals in the community who drive through, and it is a drive-through because we did it during the COVID experience, and then everything had to be done in the cars. And so we found out that that's the best way to do it rather than putting it on a big tent, where we started at initially. And in doing that, we have found and discovered that we have become a very credible source for the community in receiving services through the Health and Wellness and Safety Tailgate. We have also partnered with Quest Diagnostics, and one of the big things that we do there is provide wellness panels. And they look at that as being immensely important for the individuals that are in the community. And we've gotten some very great results and helped a lot of people as a result of that, because some individuals, as a result of those wellness panels, discovered that they had some catastrophic diseases, and they needed some very immediate attention. And that's essentially, we were able to save lives, and we also witnessed the loss of a life. That person was a little too late in the diagnosis. We do try and give as much as we can back to the community. And during COVID, we felt it important to share and show what we could do to move to the next level. So the ACEs Awareness Foundation was established, and Clyde is president of that, and we are talking about adverse childhood experiences. And what we are looking at here in this context is what is the dose effect of trauma over the lifespan of an individual. And each one of us in here experienced some level of stress and trauma in our lives. We also experience some level of chronic diseases in our lives, and that goes on from those things can affect the lifespan over the health of an individual. And so what we've done with this symposium, the first one we started, we're very proud of our ACEs Awareness, because the individual who actually was one of the persons that developed this symposium, Dr. Robert Anda, was our featured speaker. And we got people being a part of that particular symposium from all the way from Ireland. It was very exciting and interesting. And this is our 5th annual symposium, and you have to forgive me because I have to read the title because we just determined it last evening. And so, substance use disorders and suicide, unraveling the underpinnings of traumatic experience. It's going to be in April of next year, April 25th, April 14th of 2025. Check us out.
Excellent. Thank you so much, Howard. See, this is a note for all of us parents out there. This is how you create legacy. You give them a challenge, and then the sister organizes everything and everyone, and they have built this great legacy. Thank you so much for that. Matthew, we'd love to hear about what you're doing in Atlanta.
Yeah, absolutely. So hi, everyone. My name is Matthew McCurdy. I'm Executive Director and co-founder of Black Health. We're an organization based out of Atlanta, but working across the country, really focused on the impact of racism on Black communities. We were founded really out of angst. We all met during our Masters of Public Health program and really noticed that our education really talked a lot about race, talked a lot about disparities, but we didn't talk about why those disparities exist. And this was pre-George Floyd, this was pre-pandemic, but we were naming racism as really the fundamental cause of health disparities in our community and the reasons why we saw excess death and excess disease burden for Black people. So we are based in Atlanta, but we work across the country. And a lot of our work is centered on, one, how do we educate the future and current healthcare leaders? And so they use that term really broadly. So thinking about your public health officials, physicians, nurses, anybody working in the health field, how to prepare them to be better advocates for Black communities. So that's both treating patients, standing in front of people, knowing how to work with Black people, but also thinking about how we take that advocacy up to another level, thinking about policy, legislation, and things like that. And so we're working with schools, students, fellows, and then of course those currently in the profession. And secondly, we're also doing a lot of direct community service, so providing resources, screenings for early detection, and information to communities, and some of the same methods that you all are using. So panels, events, finding creative ways to engage with community, and we also have a robust digital network as well that we're using really to bring younger people into the conversation on how we take care of our health and wellness. We asked the question also about motivation, and I have the great joy being able to speak with patients, and we'll all be patients at some point, community members, about their health. But I want to tell a story about my father a little closer to home. It's a positive story, so I'll go ahead and preface that. But my dad was diagnosed in 2023 with prostate cancer, as most Black men will be. But was able to get care. But when I heard that, I was afraid, right? As any son would be, to hear that your father has prostate cancer. So it's how far along is these, how much, is it localized, what's really happening. Unfortunately, he was screened early, and I want to take some credit for that as a public health official, screening people, and I think he got the message from me. But his story is a positive one because I think many factors, right? He had insurance, right? We live in really close proximity to Emory University and Emory University Hospital, which is a National Cancer Institute. In the Winship Cancer Center, so he didn't have to drive 2 to 3 hours to get there. He's also retired, so he had time to go and get the care that he needed. And I think that we know that that's not the case for many Black men and many Black families once they get a diagnosis, if they even get a diagnosis on time for it to be treated. We know that because of the data, but I also know it anecdotally because my dad started to talk to people, right? Started to talk to his friends, his family members about his prostate cancer experience. And what he found out was really funny, right? He, I think, named 10 people who I knew who had prostate cancer who had never talked about it to another man. Right, and so, a lot of our work is also dealing with that stigma, right? That stigma of not being well, that stigma of having a disease and a diagnosis that you're afraid to talk about. And so as he started to talk to people, he would tell me stories, such and such decided to forego treatment because they didn't have insurance. Somebody actually decided, that they were just going to sort of, not tell their family because they didn't want to unload that burden on them. And so a lot of the work that we're also doing at Black Health is one, to sort of fix those barriers that lead to the undue burden of health disparities, but also to create spaces for Black people to talk openly about the health and the concerns of their health and well-being so that we can create communities that do flourish.
Amazing. Thank you for sharing that. I think the common thread in all of this is there's a narrative. And I would put money that when we walk out of here, we'll remember these stories because it's really about the humans and not about the numbers. So thank you all for sharing that. We'd love to hear a bit more about examples within your organization and how you're working in health equity. So if you can name the program, tell us about how you go about implementing it, that'd be great. Let's start with you, Bethsy.
Sure. So we I guess, work on the issues that we work in, specifically with health equity at different levels. So we do a lot of advocacy work at the federal level, local level, state level. So one example is in New York, we've been fighting for a bill, Coverage for All, which is basically to make sure that everyone has access to health insurance regardless of immigration status. So that's one example. But we do, all the advocacy that we do is based on data, and I'll bring it back to data. So we use data to inform policy, right? So based on research, on whatever is out there, we take that and then we say, okay, well, this is what's going to make a difference. And we heard this earlier today that it's important. It's a systemic issue, right? So we have to address it at the policy level. So that's one way that we do that work, and we try to advance health equity. Also, we work with community-based organizations, because a lot of our community-based organizations may not have the resources or infrastructure to do all the work that they're trying to do. So we help them by providing, through grant making, providing capacity building assistance, and ensuring that, if this is one way that you can apply to a certain grant, let's say it's a government grant, but then providing the capacity building assistance to make sure that they meet their compliance, so like things like that, right? So that's another way that we're doing it. And then working directly in the community through community engagement and programs that are on the ground addressing different health issues. So, we have diabetes prevention programs. We do work around like HIV and AIDS, and increasing, for example, access to PrEP and to our communities that may not have access. So we have those programs engaging the community, but also programs that will impact not just their health, not just focusing on health, but also the other social determinants of health. So our organization doesn't just do work on health. We also do work on education, immigration, civic engagement, et cetera. So we we try to address health equity in a very kind of like well-balanced, all-around way that we're also addressing other issues that may impact health equity.
Excellent. Dr. Glenn?
I mentioned to you that one of the things that we are looking at with the Glenn Family Foundation is trauma. And we have established and move on the premise that trauma begins very early in the life of individuals. It can find itself as being in an area of abuse, neglect, or other situations that bring forth problems in family dynamics. And so as a result of that, it is important to notice or manage or try and mitigate those effects of trauma, because repeated dose effects of trauma over time ends up in compromising life expectancies and lifespans. And so with our project and the manner in which we put our heads together, and I mentioned to you that we put together what we call HEiA. And HEiA is the most, I think what is, to me, is the most beautiful and the most important program that we have going is the Glenn Family Foundation. It is an integrated health and literacy learning management frameworks that help to minimize the life outcomes to lengthen the lifespan of individuals. How do we do that? We go into the schools in K through 5, grades K through 5, and we've been with this particular school, we've been with several schools, but Mississippi has a tendency to close schools, and so you have to move to where they open them. And we are trying to, and the one we're in now is very stable, and so we've been there for 3 years. And the whole objective there is to put together a learning module that speaks to health care and health literacy. And health literacy is by far one of the most important things that you can offer to any individual, because it makes him comfortable about himself and how he interacts with other people in society. So we not only reach through our module, our training module with the students, but we also work with parents and we work with teachers. And the whole idea is to move health literacy out into the community. And so through HEiA, we've been effective to do that. We do that. That's another one of our health fairs, but it's done right there at the school, where we invite all of the community to come in, and they receive the same thing that we put out when we do our tailgate, including dental screening. Vernon and I work very hard with that. The other piece that we have that has been, in my mind, a very important part of it is our ability to try and go out and engage partners and make ourselves available in various components of the community. We live in Cleveland and Bolivar County, but our focus is throughout the Mississippi Delta, 18 counties. We had formed a Mississippi Coalition for ACE awareness, and in that coalition we brought together principal players in the community, clergy members, educators, physicians, law enforcement people, and we talked to them about the importance or the impact of ACEs on a family and in an environment. And as a result of that, we try to encourage them to be ambassadors, to go out and do and speak about ACEs and its impact. Ministers have really done an outstanding job with that. And so more recently, with 988, the suicide crisis hotline, it was discovered through the work of the Mississippi Department of Mental Health that they had gotten a grant, but they were not being effective in getting the word out about 988. So they came to us, and we were able to employ some of our techniques and outreach programs to help to get the message out to people about what 988 actually is. So what do? We went right back to those ministers, and they are in turn being sensitized to it. They are willing to talk to it about their parishioners or to their parishioners, because one of the things that happens in the black community in terms of our cultures, we have a tendency to kind of circle around mental challenges or other crises that we don't want to share, the machoism that you were talking about. And as a result of that, in terms of giving hardcore information to those individuals, they have begun to understand that, hey, this is a subject or a topic that everybody needs to talk about. And oddly enough, and this is how God works, we started our tailgate on October the 11th. The first person there to talk to us was a guidance counselor and a parent. Our daughter had committed suicide the Monday before we put the tailgate program together. So it was very important for Clyde to, being the psychiatrist that he is, he had to put on another hat and go in and really serve as a counselor to that. Clyde also is a minister. He's been a pastor of a church for 27 years. And so he was able to work from both advantages, a professional perspective as well as a spiritual perspective. But what they got out of that, and what I was so happy about, is that they felt that the Glenn Family Foundation was a trusted source. That's right. They were able to come to us because they knew if we didn't have the answer to the problem, we were going to work very hard to point them to a plausible solution. And so that was great for us.
'em. No, it's perfect. We heard earlier that if you are not, you know, reacting and listening to the community's needs and addressing them, there is no way to start a relationship in order to have these types of conversations.
Exactly.
And it was very clear to me when I visited you all a couple of years ago now that you are well established and a trusted resource in the community. Matthew, what would you like to share with us?
Yeah, I'd just like to, add on to Dr. Glenn. I think taking the life course perspective is really amazing. Thinking about how, I think had you told me at 5 or 6 or, even 10 or 12 that my experiences then were going to have an impact on me when I was 25, 35, 45, I think I would have looked at life different.
Exactly.
So I commend that program, and I think that's really cool. We're doing work, like I said earlier, I'll talk about 2 programs. The first I'll do quickly because I think you all get it, but we're doing community-based screening. So we're working to meet people where they're at. I'm going to Spellhouse Homecoming on Saturday to screen people. I'll see you there. And so, thinking about how we can actually show up in community, like we talk about meeting people where they're at all the time, but we're actually doing that work. So, we're hosting events, but we're also attending other events and other gatherings. We were at Essence Fest, we were at CBCF. We're going where people are at and providing resources and education. But the program that I'll talk about today is really our Black Health Cares program, and CARES stands for Community Advocacy for Racial Equity School. Thanks to generative AI for that title. But it's a program that we have created to really educate the future health leaders, starting in Atlanta, and we'll do a pilot in DC. But that work is really about how do we take people interested in having health careers. So you're thinking again about your public health students, your pre-med students, and even your students in med school, and prepare them and educate them on what's happening in their local community. So we're based in Atlanta. Atlanta is known as the Black Mecca, but if you look at the data, Atlanta is actually one of the most segregated cities in the country. And long-term residents of Atlanta, Black residents in particular, have worse outcomes than transient people, so people who that move in, and then long-term white residents as well. And so that's a problem, right? Why aren't we allocating, if this is supposed to be the best place in this country for Black people to live, but Black people are dying earlier, again, having increased disease burden, that's a problem. And it doesn't stay well about the rest of the country, the rest of the nation. And so what we've really taken the opportunity to do is to take 30 students, and we're really educating them. One on that fact, right? We're showing them the data, instructing them that, this is actually what's happening here in the city. And then 2, we're really providing them opportunity to connect with local legislators. We went down to, the city council to understand how city council works. We're actually introducing them to other folks who are moving the needle on health equity and organizing in the country. And we take advocacy from a really multi-level approach, right? It's not just advocacy. It's not just me sort of going to the Hill or going to the legislative body and trying to state a case. It's also mutual aid funds, right? It's about how can I connect with my neighbor and connect with the people next to me to provide better opportunities for health for the community. And so the students, the fellows that we have, they go through 8 sessions that we've developed, and we developed our own curriculum. We have some guest speakers that come in, but they're also challenged to do community immersions. And so we provide opportunity for them to connect with local organizations in Atlanta so that they can volunteer their time, volunteer their developing expertise, and provide opportunities for them to learn, again, deeply about what's happening on the ground in the city of Atlanta. So it's been an amazing program and something that we're really proud of. We're actually going to pilot in DC in the fall. So the application's open. If you know any students who are interested and are in DC, please encourage them to apply. But that's something that we're really excited about that we're doing.
Great.
That's awesome. So when I sit here and I listen to all that you're doing, I'm like, am I a slacker or what? So I must ask the question, what else do you all need? We talk about centering the work that you're doing, centering people, but we should also be centering your needs. And so I'd love to start with you, Matthew. If we think about the people who are here in the audience, those that are represented, we have those who are represented in legislatures, we have private industry, we have other community organizations. What is it that you need in order to ensure better health outcomes for those you're serving?
Yeah, I mean, first and foremost, it's always money. But
Yes.
moving past that, I think we should really treat community-based organizations, nonprofits, the way that venture treats startups, right? not only do they provide funding, but they provide resource allocation, they provide their network, they provide training for those people, right? If you think about the capacity of these nonprofit organizations, we've all probably started and do this work because we're super passionate, not because we're probably the most well-equipped to do the work, but because we saw a need and we wanted to go out and fix that need. And so, I really think the investment is really in people, right? I would love if somebody was like, hey, I want to spend 8 weeks with you, training you to be a best executive director, to lead teams. I'm executive director because I wanted to be an executive director. Nobody else on my team wanted to be an executive director. That doesn't mean I was the best qualified candidate for my organization. And so I think, if we shift our model from one that just sort of throws money at problems and see that will work, I think we can have better outcomes if we're really investing in the people who are doing the work and providing that resource, those networks, and again, that capacity building so that they can be better at their work.
Excellent, thank you. Bethsy, what would you say there?
Yeah, I think the needs, it's important to elevate the voices of community-based organizations. So like Matthew said, with supporting with the network and the resources and even data. Like I said, we use data to inform policy, right? So, when there's a lot of us that do not have access to a lot of data or the resources to develop the data and do the research. But if you have that resource, you can support in those ways, support even through the advocacy efforts. A lot of times we have private companies or, just certain partners that come to us and say like, hey, can you guys help us advocate for this? But it may not really be what's what meets the need of the community, right? So what's necessary for the community. So it's important to have community-based organizations at the table from the beginning because, it's people that know firsthand what the needs are. It's people that live in the communities. They understand exactly what the needs are. The staff is basically, community people, right? So they really know what the needs are, and that's why it's important to have them at the table.
Excellent. Yes, please.
Well, I think that certainly both of them have pretty much captured the thoughts that we would have employed, but I would also say to you that in a forum such as we're experiencing here today is invaluable. Yep. Because my siblings and I were just sitting at the table talking this morning and just talking about all of the great things at lunchtime that we've heard and then this afternoon as well. And so it makes for a good information to have individuals come together and share ideas and be challenged by people who are giving presentations to see exactly where you are in the space. The other thing that you said besides funding, I did get the message on that. but
yes, and.
But the other thing is that small community-based organizations are pulled in so many different directions, and you have to be moving at real time in order to take advantage of various situations. And so certainly it would be great if we could get some opportunity to have within our infrastructure someone who can help us with grant writing or give us some classes or support to take advantage of these opportunities as they present themselves. That will enable us to kind of leverage ourselves against other programs and become much more effective in the community. We could probably also increase our size to become a little larger than just a sibling inspired organization. But we like it to be that way, so I guess we don't ever get that far.
Yeah, I think that'll be forever. Yes, go ahead.
I would also add, in addition to, I think funding is, of course, an answer, but it's sustained long-term funding, correct, right? I think often I can't run a program because I'm looking for funding for the next program, yes, right? And so, thinking about how we can invest over a long-term, 3 to 5 years, right? That gives me runway not only to build something and to create something or extend the work that I'm doing, but I'm then out of the hustle of trying to make sure that my employees get paid, that I can pay my staff, that we all have, what we need necessarily to live. So I think thinking about long-term sustainable funding as well for CBOs.
That's excellent. Thank you. So we're going to go to the audience for questions, and so I'll just ask my last one. So as you see, have all these attendees here in the room, and of course those who are watching us virtually online. What would you have them do differently after hearing your experiences, your needs? What does good look like for you, for these folks? Give them a charge.
I go first.
You can go first.
Well, I would say two things. So, or maybe multiple things, I don't know. But so I think it's important to work with each other, to work together. So I hope that you all were able to meet at least one other person that you didn't know from another organization, another company, because it's when there are more voices together, working together, we can do a lot more. So you don't have to reinvent the wheel. If someone else is already doing it and you can lend support, you can lend each other support, that's one way that we can move the work forward. And then I would say that it's really important to get involved with in terms of advocacy. They say nonprofit organizations can't lobby, but actually we can do a lot of advocacy work. There are limits, obviously, because they're nonprofit organizations. You can't lobby for specific political candidates, but you can advocate for certain bills and certain things happen. So I would definitely encourage that. One thing is racial impact statements. I just want to bring that up because, again, we need to address, like you said, racism is one of the moving factors in terms of inequities and health inequities. So we are trying to work on racial impact statements, which means that whenever a bill is introduced into the legislature, whether it's and any rules that come for the agencies, like for the Department of Health, et cetera, any of those bills should be accompanied by a racial impact statement. Something that says, okay, this is how this bill or this new rule would impact communities of color. And not just specifically to health, but to everything. Because you're not only going to find us, because a lot of times we see it, racial impact statements on welfare systems or incarceration or for like that, but that's not where we are only, right? We are in other places. We're homeowners, we're business owners, right? So other things will impact our lives. So we are really pushing for racial impact statements for all bills that are introduced or all rules that are introduced. So I think you should all look into that in your prospective states.
All right, hope you're jotting that down. Dr. Glenn, you're next. Give him a charge.
I would think that if we could look and recall, Dr. Ilona Kickbush said in 2005 that one of the major problems of healthcare is not a problem of disease, but a problem of governance. Mm-hmm. Governance and governments are the ones that are impeding a lot of the progress that we can make. And so we have to figure out ways through advocacy to overcome some of the challenges and the walls that government is putting before us to effectively be servants in the community. There's an old African proverb, when spider webs unite, they can tie up lions. And so this is what we have to be about. We are all representative spider webs, but if we put our voices together and put our resources together and sharing and expressing what our concerns are, we can tie up this line of governance, the political determinants of health. It was interesting that all three of us went to the same thing this morning. Yeah, the political determinants of health are one of the major things that's dictating the social determinants of health. And until we overcome the challenges that politics, governments, and voting have put before us, we're not going to be successful in moving the dial. Remember I said, Kickbush said that in 2005, and here we are, 2024, and it's the same problem.
That's right. Right. Matthew?
Yeah, I'd echo the sentiments around voting, getting involved in the policy and legislative process. I think, secondly, get involved in your local community-based organizations and nonprofits. One, I think certainly financially, look up to your local mutual aid fund. They are giving direct services and access to people who need care. But two, I think we all have non-financial gifts that we can volunteer as well. So we're thinking about as we try to build the capacity of these organizations to really lean in and get the work done, to think about your gifts that you have and how you can volunteer and support those organizations locally.
Excellent. We have time for a couple of questions, if we have any. Yes, ma'am.
It's not really a question, but maybe a plug on the funding side. So I love the runway comment because I agree. We're always thinking, okay, but I have to retain staff. I need to keep going with the program. But I would tack on to that for those who may have access to awarding funds. The less restriction, the better. Yep. Because the organizations, the people in this room, and we've been listening to it for the last 2 days, and it's been so fantastic. They're so smart. And they know how to do this. But even when it's a grant, and even when it's really well intended, when there's so much restriction and boxes to check, and you've got to do this and produce the data, and all of it is so important. But whether it's funding or, frankly, sometimes with health centers, we just hear it all the time, I just need the flexibility. If you just let me do the work, I'll show you the results. Yeah. So I think through the lens of, sometimes it's policy too, and that's an even tougher one to crack, but definitely on the funding side. And I'm curious, now you should be, if you have thoughts on that, because of the way that you touch that space, and what can we do, honestly, to help move in that direction is maybe the question that goes with it.
Yeah, excellent. No, I think it's a wonderful point, and we have to look at those who are responsible for those decisions. We'll make a bit of an announcement a little later on in our discussion today about something that we're doing, but it really is advocacy. We have to tell that story over and over again. So whenever people are launching these RFPs and you are seeing these restrictions, it's up to everyone who's received that to tell them, like, this is too hard for us to do, and we have better ways to do this. I think it's really telling the story around that. People just, sometimes they don't know. They're like, this is how we always do it. And if you tell them, then that's when you can expect different from them. Someone else has the mic?
Yeah.
It's okay. It's okay.
Thank you.
We're going to pass it on to you. Thank you for the representation. It's so beautiful to see our people in philanthropy and the ways that you are showing up. So I just wanted to name that. But for the young man of Black Health, I'm a fellow startup ED too, right? We're figuring out, we're building the plane as we're flying it. And I wanted to know how we can engage in thought leadership, both as EDs, passionate about the work that we do and passionate about serving communities. You don't have to answer now, but I'd love to connect with you after the panel.
Yeah, would love to connect. You know, something that I'm thinking about now because of a conversation I had earlier is also just how do we rest, right? How do we provide space to reflect, to think, to strategize? And so would love to really also to talk about that. Where is the opportunity for us to again, to rest and to be restorative? So would love to talk more.
Again, thank you to the panelists in this opportunity. You asked the question about how to make that funding opportunity a little easier. I can tell you just from experience, the OT 21-2103, I got to put a plug in for it again, which is the Disparities Grant that was made available through CDC, the National Initiative to Address COVID-related disparities among underserved populations. That was the most flexible funding I think that's ever been around. And that funding allowed me to be able to allocate funds to smaller organizations that would not have normally gotten it. So, for instance, I didn't put the restriction on you had to have a 501c3, but I focused on the work. They had to show that they were meeting the objectives of the grant with the work, and they had to prove to me, when writing, what they were going to do, their objectives. And I held them accountable to that. Of course, we reviewed everything, of course, but that was one of the things, we're all talking about the work here. So we can't use the word DEI in some of the places, but we got to be creative about what we're doing. So through that creativity, I was allowed an opportunity to get, even though the one little church had the deacon that runs the money all the time and does all the work, asked for $25,000. $25,000 is a lot for that little storefront that they do everything in the community. So just a plug there. Thank you.
All right, anyone else? Okay, one more, and then we will wrap the panel.
Thank you, panelists, for your.
It's working.
Thank you, panelists, for your feedback, and I'm really, really impressed with the innovative tailgate community education outreach effort. So I have a question, which is, shoot, I'm blanking out. Oh, okay.
There we go.
Funding. So you mentioned about the social impact report. And I was wondering, as a funder, do you ever consider, like, putting resources? Because it takes effort to document and to disseminate data. So I guess I'm making a request to ask all the funders to consider putting resources for the community-based organization to have the resources to document their impact. That's it.
Yeah.
Thank you. Okay, well, this has been a phenomenal conversation. Thank you all so much for sharing your insights. Yes, please. And as we all seek to create thriving communities, we need to think better about how we support those people who are doing the work, either through training, giving them spaces for rest, and advocating for more consistent funding. And so I think those are some of the takeaways that you all gave us today. Thank you so very much.
Thank you.